Welcome to ZSenQ. Today we're diving into an important topic, the H5N1 bird flu outbreak. This video will provide an in-depth look at what H5N1 is, how it spreads, the risks to human health, and what measures you can take to stay safe. H5N1, also known as avian influenza or bird flu, is a type of influenza virus that primarily affects birds. It was first identified in 1997 in Hong Kong. The virus has a high mortality rate among birds and can spread rapidly through bird populations. Since 2020, we've seen the largest outbreak among wild birds, poultry, and backyard flocks. This outbreak has raised significant concerns due to the virus also being found in mammals, including dairy cattle. The H5N1 virus spreads through direct contact with infected birds, their droppings, or secretions from their eyes or respiratory tract. It can also spread through contaminated surfaces, water, feed, and equipment. Migratory birds play a significant role in spreading the virus over large distances. Infected birds can shed the virus even if they do not show symptoms, making it difficult to control the spread. The virus is highly contagious among birds, causing severe respiratory disease and high mortality rates. Although H5N1 primarily affects birds, it can infect humans who come into close contact with infected birds or contaminated environments. Human cases of H5N1 are rare but can be severe and even fatal. Symptoms of H5N1 infection in humans include high fever, cough, sore throat, muscle aches, and in severe cases, respiratory distress, pneumonia, and multi-organ failure. The human-to-human transmission of H5N1 is limited, but there is concern that the virus could mutate and acquire the ability to spread easily between people, potentially leading to a pandemic. The FDA assures us that pasteurized dairy products are safe, even if dairy cattle are found to be infected with H5N1. Pasteurization effectively kills the virus, ensuring that dairy products such as milk, cheese, and yogurt remain safe to consume. Similarly, cooking meat and poultry to recommended temperatures inactivates the virus. To ensure food safety, it's important to follow proper cooking guidelines. Cook beef, veal, and lamb to an internal temperature of 145 degrees F, ground meats to 160 degrees F, and poultry to 165 degrees. Always use a food thermometer to check that these temperatures are reached. To protect yourself and your family from H5N1, it's crucial to practice good hygiene and take appropriate precautions when handling birds or poultry products. Here are some key safety measures. Hand washing. Wash your hands thoroughly with soap and water after handling birds, their droppings, or any contaminated equipment. Hand washing is one of the most effective ways to prevent the spread of infections. Protective gear. If you work with birds or in environments where birds are present, wear protective gear such as N95 masks, eye protection, and gloves. This reduces the risk of inhaling or coming into contact with the virus. Disinfection. Regularly clean and disinfect surfaces, equipment, and tools that may have come into contact with infected birds. Use appropriate disinfectants that are effective against the avian influenza virus. Cooking practices. Ensure all poultry and meat products are cooked to the recommended internal temperatures to inactivate the virus. Avoid consuming raw or undercooked poultry products. Avoiding contact. Limit exposure to wild birds and avoid direct contact with sick or dead birds. If you find dead or sick birds, report them to local health or wildlife authorities. Monitoring and early detection are crucial in controlling the spread of H5N1. If you work with birds, be vigilant for signs of illness in your flock, such as sudden death, respiratory distress, or a significant drop in egg production. Report any unusual bird illnesses to veterinary authorities immediately. Human cases of H5N1 are rare, but if you develop symptoms like high fever, cough, or difficulty breathing after contact with birds, seek medical attention and mention your exposure history to your healthcare provider. Current tests for human influenza strains will detect the virus, and specialized tests for avian flu are in development. Controlling the H5N1 outbreak requires coordinated efforts at the global, national, and local levels. The World Health Organization, WHO, and other international agencies are working closely with countries to monitor the spread of the virus, share information, and implement control measures. These efforts include surveillance of bird populations, vaccination of poultry, culling of infected flocks, and public education campaigns. Research is also ongoing to develop better diagnostic tests, vaccines, and antiviral treatments for both birds and humans. Staying informed about the H5N1 outbreak is vital for your safety and the well-being of your community. Follow updates from reliable sources such as the World Health Organization, the Centers for Disease Control and Prevention, CDC, and your local health departments. These organizations provide timely information on the status of the outbreak, safety guidelines, and recommendations for protecting yourself and your family. Thank you for watching our comprehensive guide on the H5N1 bird flu outbreak. By understanding the risks, following safety measures, and staying informed, you can help protect yourself and your loved ones from this virus. Don't forget to like, subscribe, and hit the bell icon for more updates on health and safety.